Ready, and then we'll begin.
Okay, ma'am, I can try.
Okay, both are ready?
Yes, ready.
Okay, so if you've read and understood, considering it communication skill station, please begin.
Hello, I am Dr. Mahmoud, one of the surgical doctor. Can you please confirm your name and age?
Hello, Dr. Mahmoud. I am Max. I am 66 years old.
Okay, nice to meet you, Mr. Marx. So, what is your concern about the procedure?
I came 2 months back for Dr. John regarding he will do for me a colonoscopy. I don't know what the procedure, how he will do this for me. Can you tell
Okay,
me
Mr.
what you will
Marx. Yes, Mr. John is my consultant. So, he sent me to talk to you. So, let me explain what is it and then
Yeah.
how it should be done. So, colonoscopy is a investigation as you have bleeding from your back passage. So this is a rubber tube which has a camera on top of the tube. So we have to put the tube on your back passage and then we will go forward and upward to see your other part of the intestine. So the image will relay on the TV screen so that we can see the condition of your intestine.
Okay, what's the risk for this procedure?
Okay, so as you know, all the operation has some risk. So here I can list the risk. So when we introduce the tube, it might cause some irritation and maybe a little bit tear on your back passage. And then when we will go forward, uh, might be like when we take some sample, it could be bleeding from there and then usually is not painful.
Okay.
And then the most dangerous complication, it could be make a hole on your intestine. Then we might need to take you for the another operation.
Okay, how can I know that there's a cut in my gut?
No, after the procedure, we will observe you for few hours.
Mm-hmm.
We'll see your sign symptom. If you have any severe pain on your tummy, and if you have any raising of temperature, or vomiting, or bleeding, bloody
Okay.
stool, then we will understand you have some problem.
Is it risky, this procedure? Because I
All
am
the
afraid
procedure is
from procedure.
risky, but I can assure you that our most skilled and experienced surgeon will do that one, and of course, you will be in safe hand.
Okay, I have. Okay, do you think there is a cancer in my colon?
Okay, it's too early to say this one, so that's why we have to do this scope, and then we can take a sample if something is. Uh,
Mm.
suspicious there, we can take a small sample and then we can send for some tests. That one will confirm you have cancer or not.
Direct, you will find the result, or you should wait for the result.
No, we have to wait usually 2 weeks. So as early as possible, when I will get it, I will get back to you.
Okay, after this procedure, when I can go home?
So usually we have to observe the patient for one day, and then if you're all right, then
Oh,
we can send you home. But
uh,
like you cannot drive the car yourself. Somebody has to come to take you to the home.
nobody with me. I cannot go. I am alone in my home.
Okay, Mr. Mark, I will talk to our social service. They will arrange something for you.
Okay. Okay. Thank you.
Okay,
Okay. Can
so
I
do you
eat
have
and
any other question?
yes, can I eat
Okay.
and drink as normal beforehand?
Yeah. Yeah. Okay.
Okay, so before one day, we will don't give you any food, and then you can only take clear fluid like water and juice. And 12 hours prior the operation, you should not take anything.
What
And
food?
to
What about the
What?
leg
like,
items, doctor?
sorry.
Continue, Dr. Ahmed asked.
Okay. What kind of food I can eat? I can drink alcohol
Okay,
or.
so for 24 hours before, you can take normal food, but within 24 hours, then you cannot take any other food except the liquid food like water, juice. And 12 hours before, we will stop you any kind of food, even watery food. And we
Uh,
have to prepare your colon. We will give some medication to you will pass loose stool for this time so that your colon can be visible on the monitor nicely.
okay. But, I don't need the GA, general anesthesia.
Sorry.
I don't I you said to me you will let me sleep during this procedure, right?
Yes,
Under
so usually it should be done under sedation. So the
okay.
anesthetist will give you some medicine, you will sleep, and after
Mm,
that, when you will wake up, then we will transfer you to the ward.
okay.
So usually you will not feel any pain.
Okay. Okay.
Doctor, what should I do with my aspirin? My GP has given me aspirin and told me it's for my blood pressure and because my father died with heart attack and my GP told me not to stop it. What should I do?
Okay, Mr. Mark, in that case, we have to stop your aspirin at least 3 to 5 days prior. And because it has a chance of bleeding, so it will not cause any major problem if we stop it.
Okay, when can I take it again?
So, like after, as I said, we will observe you after 24 hours. If we are sure that there is no active bleeding, and then you can resume the tablet.
All right. What about my blood pressure tablets? Can I take them
So
in the
blood pressure
morning?
tablet, yes, you can take in the same morning with a very little water.
Yeah.
Now you can summarize and ask for consent.
Okay, thank you, Mr. Mark. So
Okay.
let me summarize what we have gone through. So we'll do an investigation, what we call a colonoscopy. There is a rubber tube which will introduce on your back passage, and then there is a camera on top of the tube. The image will relay on the TV. So we'll see if there is any problem or any suspicious mass on the intestine so that we can
Mm,
take a small biopsy, and then we
oh,
will observe you at least for overnight to see is there any complication or not. So if you understand, you can sign. There is a legal document you have to sign it before going to
okay.
the operation.
Give me
And I
the paper.
already
I will
explained
sign.
you about the complications. Okay, so here is the consent. You can sign it, and I will leave my number to the nurse. Don't hesitate to ask me if you have any question.
Good,
Okay.
good. All right.